Hey
Hey everyone, this is the Nips and Sips podcast show featuring me. I'm Dr. Jeremy Boyd and my usual partner in crime over there, Dr. Brandon Cruz. Today we're going to do something a little bit different, and we're going to discuss the our most awkward moments as a clinician or treating in physical therapy. We all come across a couple of these unfortunate moments, but feel like we should talk, have a laugh about them, and see how it goes. But Brandon, before we get into it, how's it going?
Going well. Yeah, today's short episode, and we want to switch it up. Just make it a little humorous, especially in lieu of my grand opening today. We're doing the grand opening of the Hoboken office, so things are a little busy and chaotic, but we wanted to get an episode in as well. So we thought this would be a nice little twist and spin on it.
All right, who's gonna take us out there?
Well, I'll say this. I have coffee
yeah.
today. I don't even have a real drink. So I'm drinking coffee. I have a cool mug, I guess. It's my Colorado mug that I got when I was in Denver doing my fellowship at Regis. That's my story for today. What about you?
So I'm also drinking coffee from at least it's a coffee cup from a brewery, so at least sticking on theme to that. It's Arrowwood Brewery.
Got the triangle too.
I even have
That's
stocks from
triangle.
that from this brewery, not because I'm addicted to triangles for trifecta, but I was going up there for a wedding and I forgot black socks, and they just so happen to have socks, so they're actually my favorite socks. But up in New Paltz, if anyone wants to go there, excellent brewery, hands down. Ambiance beer was top of the nines. But yeah, today's a coffee day. It's a little early, got a lot of stuff on the plate to do, so
Exactly. I'll go off with the most embarrassing moment. I'm sure we all have a few. This one just sticks out the most, and maybe we'll talk about a couple second and third ones. This one happened actually at my first job. I was maybe a year out. My aide at the time, Marta, who's actually now works for me at my company now, she's gone through and finished PT school and things like that. At the time, she was an aide in undergrad, and she asked me to treat her sister. Her sister was a D1 volleyball player at the time. Now she plays professionally overseas. She comes in, we're working on her hip, things like that. At this point in time in my career, I dressed up to work. I wore a button down, or a polo, usually a button down with dress pants, dress shoes, try to look sharp and professional, really carry that doctor title, things like that. So she comes in, I'm demonstrating a squat for her, or something along those lines. And I had these brown dress pants on, and halfway down in my squat, they just rip right on the seam, literally from crack all the way to front. You just hear a streaking like, Marta and I look at each other. Marta's like, what just happened? Did I think what just happened? I was like, yeah, like no word said. We just, all just looked at each other. Her sister had no idea kind of what was going on. And she's like, what? What's going on? And I'm like, yeah, just ripped my pants. Right. So I turn around. It's just, my boxer briefs are just kind of hanging out.
Well,
And
what color, what type of boxer briefs are we
dude,
talking about? They tell me they were like a bright color that everybody can see.
no, I don't know, red or black, probably. I can't remember the details of that. I just remember I had brown pants on. Maybe if you ask Marta, she might remember. I don't know. I was also obviously very kind of embarrassed. I got my coworker there, gym full of clients, and then my actual client who I'm working on. And I met for the first time too. It's not like I had a rapport with her at this time.
Oh, this is the initial eval?
Yeah, initial eval.
That's even better.
So I go in the back, and we have clinic shorts that we give to patients. So I put them on, and they're like ultra small. We're talking like 1980s basketball small. So I put them on. Literally, I think my boxer briefs are kind of hanging out the bottom.
Ooh,
and I'm like treating the rest of the day in these shorts, and I have dress shoes on and dress socks on. Oh. And that's just me for the rest of the clinic, just rocking that. It was also the winter time, so I remember being a little ashier than I would have liked to have been. So yeah, it wasn't a good look, man. I don't know if we have a picture of that. I should ask to see if we have a picture and post it up or something. But yeah, it was pretty bad.
We'll make that the profile picture of the Nips and Sips.
Yeah,
the logo.
We'll change it out.
That's happened to me twice or 3 times in my career. Now I finally learned to use shorts or athletic pants, but one time it happened with Tom, who's been on the show. And luckily I was wearing like black boxers. I even tried to make it work. And he's just like, why don't you go home there, son? And like,
At least you got to go home.
yeah. So my apartment was very close to the clinic. And he's like, I'll watch your patient. He's like, why don't you go home and put some new pants on? So thanks, Tom, for because it was like had to be middle of the day. I still had a big chunk of my day left. But
Yeah.
yeah, shout out to my mentor there for looking out for my my pride as well as my clinical skills there. But all right, I'll go with one. I mean, we have a couple. I just naturally get into awkward moments, I guess, especially when I was a student. But when I was in inpatient rehab for as a student, I just had the bad luck of every time, they would wheel the patients in on their wheelchairs or transport or bringing them in, my patients were always in the bathroom or doing something. So I'd always have to wait for them. And then my instructor, Wendy, she was just like, you know what, you helping them go to the bathroom or anything like that counts as a unit. It's a functional activity of sorts. So she's like, why don't you go get them, and if they need to go to the bathroom, just help them out. And I had this one patient, great guy. He had a cabbage, from what I remember. I can't remember his name, but he had the exact, the old guy on Family Guy who likes Peter, not Peter.
Likes the sun. Yeah.
Yeah, and that raspy
Herbert.
voice.
Yeah, the creeper. Yeah.
Yeah, he had the exact voice. I was convinced that he was the voice for that character. And I remember like reading, it's like, cabbage this, blah, 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 and vocal cord dysfunction. I was like, whatever. And I went to go treat him, and then I get this voice. But he hated everybody besides like me and my CI. Hated the doctors, the nurses, like just old man veteran. And you just see like, I hate everyone. So I'm not doing it a service here.
That was actually pretty good.
Yeah, and he would say, and I remember he was on, what was it, Lasix, which is it's a kind of water pill to try and help you pee and that sort of stuff. And he's like, they have me on this shit, I still can't pee. And he would always say that during a session. But this one time he's like, I gotta go. And half the times we'd go, he just couldn't get anything out, just shooting blanks there. So I had to bring him on back this one time. So I'm like, all right, no worries, we'll go. And he's there, and so he's at the urinal, and he's like standing, and he's just like trying to talk, and he's still like complaining. He's like, I hate everyone, blah, 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 this. And then he starts like looking down at his package there, and he's just like starts like conversing with it. He's like, come on. And I'm like just trying to guard him, like fake guard him, and I'm starting to like laugh at this moment. And then he gets to the point where he's violently shaking. Like you can see his old little frail body shaking. He's like, come on, you son of a bitch.
Shaking it more than twice, you're playing with it.
Yeah. So at this point, I'm almost on one knee, like crying in tears as he's shaking this thing. And sure as shit, as soon as he like yelled and said, come on, you son of a bitch, the floodgates open and you just hear it.
It just unleashes.
So that was probably my most funny, most awkward moment I've been a part of. I was dying laughing. But yeah, I thanked him for that. That was the best minutes I used in the clinic. I definitely cracked up on that one.
Yeah, just reminded me of one. Thank God it wasn't me. As a student, right? Because that was your story as a student, right? You're in a hospital setting, right? Yeah. I was doing, I think we did like the orthopedic floor. Like, so this guy had like a total hip, but he had like dementia. He wasn't there, right? And we go to transfer him, same thing, to the bathroom to go to pee. And like right when he goes to pee, his dong just flips up and shoots right across between, like, my CI's here, I'm here. It just goes right in the middle. And we're just like the Matrix, like dodging this thing. And it goes just right. And I just see urine past my CI's glasses. and we just look at each other. We're like, all right, we're done here. Like we finished him up and we got the hell out of there. But yeah, inpatient is it's something else.
Yeah, we should.
I couldn't do it every day.
No, and then you get the laughs like that, but then you get where you don't get the close calls and it's on you, and I can't do it. Luckily, I had a career where nothing got on me and nothing I had to like really clean up, and hopefully now that we have our own businesses, I'm full clear out of that woods there, because I heard that's a pretty rare thing. From what I understand, most of my classmates had to do some sort of dirty work. And shout out to the therapists that do that on a regular basis and all the other medical professionals, but not exactly what I signed up for. So
not my passion.
None of that. But that's an intense moment there.
So do you have another one? Because now
I can go for days.
Like,
I know how I became a physical therapist. It's part due to an awkward moment. I don't know if I've ever mentioned this story on the show here, but found physical therapy via Google search, yada yada. I go to Jersey Physical Therapy with Mark Rubenstein. Shout out to him for giving me my first opportunity. And I was just shouter, help out with towels, hot packs, whatever it may be. And there was a bunch of us, like young people shadowing or aides. And there was this one guy who came, an old guy, kind of hunched over and everything like that, and always wore jorts. This is going back 2000, well, my class of 07, 2007. So always wore jorts, and it was weird. Every time, like all the shadowers, aides, therapists, everybody had a good rapport with everyone, would talk, and you had a couple like staff members talking to each patient. But when he came in, everyone went to like the other side of the room besides the treating therapist. And I was a new guy and that sort of stuff. And I never quite understood like why that was. And then one day, like he was on the table getting like his hamstrings stretched out. And this old man, he was going commando in that bad boy. And so I got to see a little foreshadowing what happens to male anatomy when you're in your 80s or so. And it was great because pretty sure it's Mark working on him. And like, again, usually Mark is like looking down, talking, and he's doing the stretch, and he has to he's like looking out the window talking to the guy. And I'm just, I just looked to the left and saw it, and so it's glory there. And I was just like, got another thing that just made me laugh uncontrollably. I was like, if I can have that type of humor and everyone's laughing about it and like enjoy helping people, I was like, this is the career for me. So not saying that seeing an old man's junk is what really started
maybe it
off.
is.
The laughter that came from it is what kind of got kickstarted for me. But yeah,
there is something about older men in jorts and not wearing underwear. I've seen it too. I used to work at a gym, same thing, like a 55-year-old dude. He was on a leg press, and it's like, what the fuck's going on, man? What are you doing?
You have to know. You have to know that those suckers are out there.
Yeah.
Oof. What other ones that you got?
I have some like embarrassing ones. Like, it's amazing we do a podcast and we teach, and we teach, have taught at universities and teach on our weekend courses and stuff, because I've had some like, I guess it was social anxiety or what. 2 in 1 weekend, man. So Cheryl, we should get her on the show. She was in our residency cohort. Her and I went to Manipalooza one year, and it was out in Denver, Boulder, Colorado. And this was 2013, 14? I think it was 14, May 14. So pain science was really, that pendulum had swung hard, right? To that direction. And Adrian Lowe was one of the speakers. So we got in the elevator. We arrived late. We got in the elevator at the hotel, like the conference was staying at. And Adrian Lowe like pops in, like we hold the door, and what do you know? Like Adrian Lowe pops in, right? So to me, this guy's like a legend. Oh, is that Adrian Lowe? Oh my God. So I'm like, say something. It's just awkward. We're standing here in the elevator. I'm like, oh, are you Adrian Lowe? And he's holding this bag, and he's like, yeah. You could tell he kind of didn't want to talk. Like he had probably just gotten into. Right. So he's like, yeah, I'm Adrian Lowe. I'm like, that was it. I did not say anything else.
Didn't
We
even
just,
say
yeah, it was just
I'm
really
Brandon.
awkward. Like I froze. I didn't know what to say. Like, cool or nice to meet you. Like, I'm excited for your, listen to you speak. Like nothing. I just, yeah, couldn't open my mouth. Great. Awful. And Cheryl was like, what the fuck was that? Like, you derp. Right. So that's that. Then later on that I think it was after the first day, we had like, a shindig, they had drinks, a little happy hour type thing. And Paul Minkin is there. And little, later on I get to actually meet him and talk to him and actually be normal around him. He probably doesn't even remember this. But like we're just standing there. I don't know, we're like newbies. Everybody has been to this conference before, and we're trying to find out where our place is, type of deal. And Paul comes up and he's just kind of like, like, how'd you like the first day or whatever? I was like, good. Like nothing else.
That's it.
We stare at each other, and then I just awkwardly just turn away from him and just walk away, like not knowing what else to say. Just awful. And
man.
yeah, and again, shows like, what the fuck is wrong with you? Like you talk no matter what to anybody, and like the 2 times you get to talk to somebody here, you just fucking freeze up. I'm
Man.
like, what do you want me to say? I'm like, it's Paul Minkin, right?
Yeah.
Ordinary dude, chill as hell, obviously. Luckily got to meet him at some AM conferences and Regis, where I really got to get to know him a little better. But yeah, it was just like, what a swing and a miss, man. Awkward, just yeah. So
man.
so those are yeah. I was like Tom Hanks in Castaway, man. I was just out on an island by myself there. So I think I've gotten better now.
Yeah.
7 years later, I can actually go talk to some people and be okay. But yeah, man, it was my first year or two. Was a little brutal there.
Yeah, it happens. I get it. Both Louis Puentedera and Chad Cook during I think it was CSM was before I presented at AM. So it was a CSM. Both were walking in the poster section. I was standing by mine. Louis didn't really look too much at my poster or anything like that. And I knew where they were. And in both situations, I did one of these like, hey, like, oh, I'm trying to engage you, but I don't know if you want to be engaged, and like kind of like tucked it back in. It was bad with like
T-Rex
Chad.
arms,
huh?
Said you had little T-Rex arms.
Yeah, little T-Rex arms, fitting for my costume this last Halloween.
Exactly.
For any of you who didn't know, I was Rex for Halloween. I was manipulating
Rex from Toy Story.
From
Not any Rex from Toy Story.
Toy Story. I wish I had like his voice that could have just worked all day, but I couldn't do that. I should have just used old man raspy voice. So it's probably close enough. But
yeah,
that was a fun day of treating. But yeah, in both situations. But like Chad, I kind of looked like he maybe at least read the title or something. Maybe I'm giving myself more credit. But I was just like, it was more one of those, like his sounded like a little mouse.
Yeah,
You're more just amazed. I'm like, wow, these people really do exist.
Yeah.
So yeah, we've been there, done that, but they seem like all pretty normal people and that sort of stuff. I talked to Adrian at one conference. He seems like a pretty nice guy. He gave me some advice, which was cool. But that's it happens. But
I have one last one. This was my first week of like clinical practice.
I got one good one after this.
All right, and then we'll wrap up. First week clinical practice. I have some lady who got like a total hip replacement. She had to be like, I don't know, 50s or early 60s. So we're walking. I bring her over to like the stretch cage that we had at the clinic I was at. And she just like starts bawling out, just starts crying. Right. And I'm like, what the fuck? Like, can we just do some exercises? Right. Like, I had no empathy, no sympathy at this point. I'm like ready to go. Like, I'm just getting out of school. I'm ready, like ortho sports, like just, let's go. And so I didn't know what to do. I'm like looking around, and it's funny. My former coworker / mentor, Diana at the time, she's looking over. She's like, fucking, what's wrong? I'm like, I don't know. So I had no idea what to do. So I just put my hand like on her shoulder, like, pat, like it's gonna be okay type of deal. Like thinking that that was showing empathy or sympathy at the time. I guess that was my version of it, or what I was able to muster up at the time. So yeah, so I go back and I was like, what was that? Like, that's how you show compassion? I was like, yeah, like just pat her on the back. It's gonna be okay. What else you guys do?
You'll
And
be
she just,
okay,
shakes her
sport.
head. So clearly I had a lot of work to do on my communication and empathy aspect that Kyle Feldman is so naturally gifted at. But yeah, I was just like, yep, all right. It's like, like a kid strikes out or misses a shot and you just kind of pat him on the butt as they go back to the bench. Like that's kind of what I was doing there.
60-year-old replaced.
Yeah. But I was just like, why are you crying? Like nothing happened. She just like out of nowhere started bawling. And I was just like, help me. I need to relieve, bring in the righty, take care of this.
Man. At one point in my career, I was making so many people cry just from like talks or random bawling out because maybe that patient got so comfortable with you they decided to let loose. And I'd always be like, I at least took it a step further and gave him like a shoulder to legitimately cry on, but it was always mascara, tears, and always, it was never when I wore a black shirt or a dark blue shirt. Every time it was a white shirt. So at one point I was like, all right, no more white shirts. It was literally like always right here. It's like makeup of some sort. So it's like, yeah, I'm done with this.
So just don't wear a white shirt and then they don't cry anymore.
Yeah, I mean, I think that's what it was. I don't know, maybe it was like they're marking me like a dog marks a fire hydrant. They're like, this guy's fresh.
Yeah, that's mine.
But I got two stories. Unfortunately, with the same patient. I think I mentioned the one before. So Big Dan. This is a show of evolution and growth as a therapist. So I was not always a good manipulator, not saying I'm an amazing manipulator now or anything like that, but when I was learning the techniques, the supine pistol technique from residency and trying to apply it in the clinic, Big Dan was a corrections officer, built like a brick house there, and he's super cool. He'd let me like do some things. He was there for his hip, but he was complaining something about his back or something like that. And I was like, hey, I want to do this, but he was big. I can always do it on smaller clients. And Tom was mentoring me, and I'd always just have tough with the setup, getting the hand that was on the spine itself right. So I finally get it right, and he's a larger guy than me. And I finally get it, but like I'm so close to his face that he starts cracking up, Dan. And I start laughing as a result of that. And I'm just holding him. And this is the first time where it feels comfortable and right for me. And I straight up say, I'm not letting you go until we're doing this. So it's just two grown men just embracing each other for like a whole minute as we're laughing. And Tom, I'm pretty sure Tom took pictures of it. It looked very, very awkward, and I finally was able to do it. But it was very awkward. It's the fact that I just would not let a grown man out of my hands because of
two men sharing a moment. There's nothing wrong with that.
Yeah, it was all right. If you know Tom, from our previous episode, he'd always take like pictures of me, like if I was on and was like doing a thing, and like the patient's like leg covered my arm, but it looked like I was like up their keister or something like that. So I have lived that moment for many years afterwards. But the same patient, so Tom's mentoring me. I think patient we diagnosed him with a labral tear, which in retrospect I would like to have that again. But before that, I don't know if it was before the surgery or after the surgery, but I'm working. He's still having hip pain, and Tom's like, we haven't tried some kinesiotaping. Why don't you try that? And I was just like, I don't really know how to do that. It's not something I utilize often. He gives me some advice down a track there. So I was just like, all right, I'll do it. And so it was his hip and everything like that. So I didn't want to do it on a table in front of all these people. And behind the therapist desk, there was this hallway because we were in a building that connected multiple offices, chiropractor, a physician or dentist or something like that. So it was like a creepy hallway in the back that straight up was, black hallway and a flickering light most of the time. So it wouldn't work all the time. So I take the patient there, and
Murder hallway.
huh?
It's like a murder hallway.
Oh yeah, it's murder hallway. So and I'm like, all right, I'm gonna try this taping thing and gotta get up towards your hip and going down towards your knee. And so like, yeah, I need access to that area. So he drops his pants and still has his boxers on and that sort of stuff. And and so he's a taller guy. I'm on one knee.
Oh, here we go.
So I'm taping this, and Tom comes around like he's just wrapping up a patient, and then comes around and he sees me looking down the hallway, the patient facing me as I'm on one knee trying to tape. So that looked terrible. Look in a flickering light hallway. I mean, it was an awful look.
Something that would be brought to the ethics committee.
Yeah, I lived that one for a while, and I'm pretty sure like the worst part was Dan he was a hairy guy, so the tape didn't even really stick, so it was almost for nothing. Shows you, probably shouldn't go do much taping, but yeah, that was a pretty awful moment. I don't know if he got a picture of that. I hope he doesn't. I'm scared if it comes up or resurfaces, because that's pretty incriminating there.
Well, Tom, if you're listening, feel free to send it to the emails or text it to us. That'd be great. I'll make sure it gets into the right hands. We all have them, guys.
Yeah.
Embrace it, learn from it, have fun with it. We're not perfect. So all good stuff, man.
Heck yeah. Enjoy. That's what makes it fun. If you can't laugh about it, is it worth doing it? Well, that was a good one. And yeah, thanks for listening in, guys. And any updates there, Brandon, besides Office 2 grand opening? Congrats.
Yeah, we have that. Where are we now? This is depends when this gets dropped and released. We have our extremity course this weekend, which will probably be too late for that. We have our semi-private course at Perfect Stride, November 13th, 14th. That's actually a sellout as well. And then we have our spinal manip course December 4th and 5th to wrap up the year. That's actually almost filled out too. So if you guys are interested, definitely sign up or DM me or Jeremy for any questions or inquiries. We are working on releasing the 2022 course dates as well. And if anyone's interested in holding a private course or semi-private course, please reach out to one of us and we can set that up.
Yeah. Awesome. Looking forward to it. Thanks for everybody for listening in, and cheers.
Yes.